This is a right radius. As we know that the radial tuberosity should be placed anteromedially, and the head of the radius is disc-like, and it should be towards the proximal end, and the lower end is expanded and it should be towards the distal end. This is the styloid process, and this should be placed laterally. So this is a right radius. The head is concave, and this attaches to the humerus, to the capitulum of the humerus, and it is disc-shaped. This is the circumference of the head, and here it contains the annular ligament, which attaches to the ulna and forms the proximal radio-ulnar joint. This is the radial tuberosity, and at the lower end we have the lower end is expanded in shape. It has a styloid process, and the medial surface is triangular, and it forms the ulnar notch with the ulna and forms the distal radio-ulnar joint. It has 5 surfaces: the anterior surface, the medial surface, the lateral surface, the posterior surface, and the 5th one is the inferior surface. The inferior surface is divided into 2 parts, a triangular part and a quadrangular part. The triangular part articulates with the scaphoid bone of the hand, and this articulates with the lunate bone of the hand to form the wrist joint. So we have 4 joints in total: the elbow joint, the proximal radio-ulnar joint, the distal radio-ulnar joint, and the wrist joint. The shaft of the radius has 3 borders and 3 surfaces. This is the anterior border, and it starts off with the anterior oblique line. This is the interosseous border or the medial border, and this, continuing from the radius, is the posterior border. The surfaces, there are 3 surfaces as well. The surface between the anterior border and the interosseous border is the anterior surface. This is the posterior surface between the interosseous and posterior border, and this is the lateral surface. Muscle attachments. On the radial tuberosity, we have the insertion of the biceps brachii muscle on the anterior surface. Then on the anterior surface, we have on the anterior oblique line, the flexor digitorum superficialis muscle. After that, we have the flexor pollicis longus muscle, and then the pronator quadratus muscle. On the lateral side, we have the pronator teres muscle on the lateral surface. Then on the posterior surface, the muscles present are the supinator muscle. After that, we have the abductor pollicis longus muscle, and then the extensor pollicis brevis muscle. And on the lateral surface, just above the styloid process, we have the brachioradialis muscle.